Hey everybody, welcome back. This lesson is about the shoulder as seen in CT imaging. We'll start with a volume rendered image. This is a volume rendered CT image of the shoulder. CT is an excellent imaging modality for evaluating bone anatomy throughout the extremities, but CT is not usually the preferred modality for evaluating muscles, ligaments, tendons, and other soft tissue structures of the extremities, including the joints like the shoulder. MRI is the preferred modality for those structures. For that reason, this lesson will focus on the bone anatomy of the shoulder. Let's start with a review of the humerus. This volume rendered image is an anterior view of the right shoulder joint. Here we're looking at just the humerus. The most obvious and prominent feature of the humerus is the shaft, which extends from the shoulder joint down to the elbow. The medial surface of the proximal humerus contains the humeral head. This is the rounded surface that articulates with the scapula to form the glenohumeral joint. The phrase gleno refers to the glenoid fossa of the scapula. That's the cavity that receives the head of the humerus to form this joint. The glenohumeral joint is simply the technical term that refers to the shoulder joint. The lateral surface of the proximal humerus includes two bony protuberances called the greater tubercle and the lesser tubercle. Both of these tubercles are points of muscle attachment between the arm and the thorax. There's a shallow valley between these tubercles called the intertubercular groove, also called the bicipital groove, because the bicep tendon runs through this groove. Now we'll look at the scapula. The scapula is a flat, triangle-shaped bone with several surfaces and appendages that all contribute to the function and stabilization of the shoulder. First, we'll take note of the surfaces and angles. The scapula has a superior border, a medial border facing the spine, and a lateral border facing the humerus. The scapula has a superior angle, an inferior angle, and the lateral point of the scapula is the glenoid fossa. This is the shallow cavity that receives the head of the humerus to form the glenohumeral joint. Just like all bones, every feature, surface, and structure of the scapula is given special names for descriptive purposes. In this lesson, we'll just observe the basic anatomy that we can see in this image. The anterior surface of the scapula is called the subscapular fossa. Sub means below, indicating that this is the deep surface of the scapula facing the ribs. The subscapularis muscle attaches here. We can't see the posterior surface of the scapula from this angle, but we can see this feature extending from the posterior surface called the scapular spine. The scapular spine is an important point of muscle attachment. The scapular spine extends laterally over the head of the humerus to form the acromion. The acromion articulates with the clavicle to form the acromioclavicular joint. We can also see this structure called the coracoid process. Several muscles of the arms attach to the coracoid process. Now we'll look at the other side of this image. This is a posterior view of the scapula and humerus. The sharply defined ridge along the posterior surface of the scapula is called the scapular spine. The scapular spine creates two distinct surfaces on the posterior side. The surface above the scapular spine is called the supraspinatus fossa. The surface below the scapular spine is called the infraspinatus fossa. Both of these fossae are important points of muscle attachment. The scapular spine extends laterally to form the acromion. Now we'll look at an axial view of the shoulder. This is an axial view of the left shoulder on a different patient. There's a few things to notice about how this image was created and how it's displayed. As with all bony anatomy, this image was reconstructed with the bone algorithm. It's displayed correctly with a window width of 2500 and a window level of 600. That's a common windowing technique for displaying any and all bones. Also notice that the display field of view has been reduced to demonstrate only the left shoulder. That's important for a few reasons. First, we're only concerned with the left shoulder in this scan, so it is important to correctly reconstruct just the left shoulder. Secondly, reducing the size of the display field of view can significantly increase the image spatial resolution. The bony features of this shoulder are sharper and demonstrate more detail because the display field of view has been reduced reduced to display just the shoulder. Finally, notice that the bottom of this image is the posterior side of the shoulder, and the top of this image is the anterior side of the shoulder. Axial images in CT are always oriented this way, but the bones of the shoulder have such strange shapes that this could become a little confusing if we don't remember the orientation. We're looking at the most superior edge of the bony anatomy of the shoulder. At this slice position, we can see the lateral end of the clavicle where it articulates with the acromion of the scapula. This articulation is called the acromioclavicular joint, or AC joint. We'll move inferiorly through the shoulder. Now we're below the level of the acromioclavicular joint. We can still see the clavicle. We can no longer see the acromion, but we can see the scapular spine. Remember, the scapular spine extends laterally and ends at the acromion, moving inferiorly in the axial plane. This is a very important image of the shoulder. Most importantly, we can see the glenoid fossa of the scapula, where it articulates with the humeral head of the humerus at this joint called the glenohumeral joint. We can see several other features of the scapula now. This flat area is the scapular body. This is the part of the scapula that forms the triangle shape. This anterior projection of the scapula is again called the coracoid process. Several muscles attached to this point. This posterior projection of the scapula is called the scapular spine. The scapular spine divides the posterior surface into upper and lower halves. And remember, this is the bony feature of the scapula that extends laterally to form the acromion. Finally, notice that we can still see the clavicle. Moving inferiorly, we can see most of the same structures, especially the glenoid fossa of the scapula, where it articulates with the humeral head of the humerus at this joint called the glenohumeral joint. We can still see the clavicle on the anterior surface of the chest and the scapular body against the posterior thoracic wall. Now we can see some other important features of the proximal humerus. We can see these two protuberances, the lesser tubercle and the greater tubercle, and the space between them called the intertubercular groove. These tubercles are points of muscle attachment, and the biceps tendon runs between them in that groove. We'll look at one more axial image. Take note again of the scapular body lying against the posterior surface of the thoracic wall. This is part of the scapula that forms that triangle shape. This is a good slice position to point out some features of the shaft of the humerus. The outside of the humerus is formed by ultra-dense cortical bone. The inside of the humerus is formed by this web-like bone called trabecular bone. Most bones have the same kind of structure, but it's very obvious in the humerus and other long bones. Now we'll look at the shoulder in the coronal plane. This is a coronal reformation of the shoulder on the same patient. The slice position is at the anterior surface of the shoulder, where we can just begin to see some of the bony anatomy. We can see the clavicle, which we know joins to the shoulder by way of the acromioclavicular joint. We can also see the coracoid process, that anterior projection of the scapula that serves as a point of muscle attachment. We'll move posteriorly in the coronal plane. We've moved now posteriorly by several millimeters. We can now see the characteristic anatomy of the shoulder joint. We can see the glenoid fossa of the scapula. That's the shallow cavity that receives the humeral head of the humerus to form the glenohumeral joint. At the proximal humerus, we can also see the greater tubercle and the lesser tubercle. This slice position also gives us a good view of the shaft of the humerus. Notice that we can see this thin line, which is simply the superior border of the scapula, and we can again see the clavicle. We'll move posteriorly in the coronal plane. We can see the same anatomy and more. Notice the glenoid fossa of the scapula, where it articulates with the head of the humerus to form the glenohumeral joint. Now we're at a slice position at which we can see the clavicle articulating with the acromion at the acromioclavicular joint. We can again see a very good view of the shaft of the humerus. Thanks for watching. That's been a review of the bony anatomy of the shoulder as seen in CT imaging.